All right, back to my lecture series for 2024. We're doing the vibe board again, and this is a really cool toy. I really like it. So I get to draw on it and play with it. So we'll kind of show you what how this works here. So the topic of today is breast augmentation over or under the muscle, and this is like the heated debate, I would say. I find like it's becoming more recently. It seemed like the new trend in society is talking about the over the muscle, and it's really coming from the reconstructive side of our specialty. I just had a recent conversation with one of my fellows actually about this, and I felt like I had to convince her, which is kind of interesting to me. But it's something that I think patients should be more educated on. So that's what I'm doing. Here we go. Breast implants aren't new. We've had these for a long time. General anatomy, this is important to understand anatomy, is that the female breast, it has a tail, and if you look at the breast, the breast is not just round. It kind of carries all the way up to here. It kind of looks like this, okay? And if you have someone who you dissect them, and this is their gland tissue. On the side view, this is the chest muscle, these are the ribs, and it's the gland. It's an organ, and the organ is designed to create milk during pregnancy, and it obviously comes out the nipple. But the anatomy of it is very, very important to understand, is that where the areola and nipple should lie in the vicinity of the chest. It should be in the mid-chest. You have a fold, you have the axillary fold here, you have the sternal bone, which this is that chest bone here that determines your cleavage width. That's a common question. And on a side profile view, when you take the anatomy and you put an implant in, these are the kind of like we call the planes of where an implant should live. The most common two augmentation planes are going to be over the muscle, which you can see where the implant sits on top of the chest muscle, which is called the pectoralis major. That's going to be sitting on top, and then you have the gland in front of the implant. Okay, historically that's how we started doing augmentations. When we first started doing augmentation with implants, we did it on top of the muscle. And then the trend started happening is where we started putting implants under the muscle. And so it's behind the muscle and it's behind the breast tissue. So everything's in the front, but the implant's directly behind the implant. This is just an example of this new kind of technique that's becoming much more, marketing. It's more of a marketed, term to me. It's called subfascial, where you actually lift the very, very fine white fibrous layer of the muscle, and you lift it up. You put the implant underneath it. And so that's a topic among itself. Like, I've been doing this a long time, and I've seen that muscle fascia, and it's extremely, 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 extremely thin. Arguably not even dissectable to get underneath it. And I just think it's misleading to say, for surgeons to say, I'm gonna put your implants under the fascia. It doesn't really truly exist in a great anatomical layer. It's just as painful as breast augmentation under the muscle, because you've damaged the muscle. You took the covering off. It's not very fun. So we're not going to talk about that plane, but we are going to talk about subglandular versus submuscular. And so, big picture wise, the implant on top of the muscle is going to live here, and then the implant under the muscle is going to live under the muscle. And so these two planes are the most dominant kind of planes right now for breast augmentation. There's pros and cons to each, and that'll be on a separate topic. But these implants are usually round, and the idea is to recreate the natural anatomy of the breast. And under gravity, the implant kind of looks a little more teardropped, and so you have a nice kind of a slope of the implant. As we increase the profile of the implant, you kind of get more of that rounder, like, pusher bra kind of look. We call upper pole fullness as implant projection increases. So kind of depends on what the woman wants. So subglandular pros versus cons. I'm going to talk about this one first, because I think the cons of this technique are, significantly higher than the submuscular. And so for the pros, what I would say the pros of this is that, one, the big thing with this is that it's over the muscle, so you're going to have no muscle damage, and so decreased pain after surgery. It just won't hurt as bad. You're really not damaging the muscle, which tends to ache and be more uncomfortable. So you have a little bit less pain. The second thing is there's no animation. And so what is animation? Animation is this visible kind of contraction of the chest muscle. And if you flex your chest like that, then what happens, it pulls the implant up, and if the implant's under the muscle. With subglandular plane, that won't happen, because you're still able to use your muscle, and it's not attached to the implant scar bag, which is the capsule. It's not attached to it, so you won't get that animation aspect. And so, if you think that's a con for submuscular, we can talk about that. We're going to talk about that in a second. But you won't get these. If you look at, I would say those are the two pros for subglandular. And here's, we're going to talk about the cons. So the cons are, to me, significant. So you got one, is you have this increased risk of capsular contracture. And capsular contracture is that scar bag that forms around the implant. And we know, the cause of capsular contracture, which is really just contamination of skin flora or gland bacterial flora to the implant surface. Your body sees it, doesn't like it, and it causes constant inflammation. What happens is you get this thickening of the scar bag. It's called capsular contracture. It can happen both subglandular and submuscular, but it's dramatically higher with subglandular. So that is a problem. What happens, you get like this two round ball effects. Two is that, especially in thin women, it's increased visibility of the implant edges. You see the implant edges more, much more so with the saline implant, because you'll see these rippling around the implant. If you're really lean and you don't have a lot of breast fat, you will really see it. Can't make it go away completely with the silicone product. It gets better, but still, you have less soft tissue covered implant. It's just going to be more visible because you're leaner. So thin women, you should expect that if you have a subglandular implant. And then I think one of the most important ones of subglandular augmentations you really need to consider is that this gravity effect and aging. And this is a big one for me. And the reason for that is that, implant or no implant, women with larger breasts, as you age, your breasts they have gravity constantly pulling on them. You're not getting younger, your collagen's getting thinner, you're losing elasticity, and things are going down south, okay? This is gonna happen to your face, it's gonna happen to your body, it's gonna happen to all parts of your body. If you have bigger breasts, guess what happens? Everything starts descending. It's just the way it is. It's gonna happen. I'm sorry. It's gonna happen. So if you have implants, what happens is you have an implant on top of the muscle, you add more weight, and the only thing holding that implant up is really your skin and your soft tissue, your breast. And so it's pulling the ligaments of the lower breast, and it's putting more stress over time as you age, and gravity takes hold of larger breasts, and then you get descent. So those women who have subglandular implants that are in their 50s, 60s, I can almost guarantee you their implants are down here, over kind of at the level of their lower ribs. It is what it is. You have implants on top of your muscle. And so this is something that I don't think people fully appreciate. When you start asking a surgeon, I want to have implants on top of the muscle. Well, you need to have this conversation with your surgeon. The submuscular concept. So first of all, submuscular, you can put an implant completing the muscle, but you also put an implant, it's called a dual plane technique, where it's halfway into the muscle, halfway under the breast tissue. So I would say that's the most dominant form of augmentation at this point, probably in the last, 20 years. That's my personal technique. So, the implant will be partially under the muscle, and you take the implant and it looks like this, and the muscle kind of lives on the top half here, like that, and then the gland tissue is on top. So you get more of a kind of it's dual plane, so you get benefits of both, and I'll tell you why that's important. So the cons, I would say the number one con of this is that you can have animation. And so when that muscle contracts, what happens is that muscle is attached to the scar bag, which is called the capsule. And as the muscle contracts, you go like this, what happens, it pulls it up, and then it will displace it. So it kind of moves a little bit. So women with implants on the muscle, they can kind of move their chest, and you'll see their implants move a little bit with that. There's, the surgical technique, you can make it better or worse, but for the most part, you're going to have some amount of animation with the contraction of the pectoralis major. 2 is right after surgery, it's going to be a little bit more painful. We actually release the muscle on the lower half of the chest, and so that hurts. Like, it's a very vascular structure. Muscle is very vascular, and it's going to be cut. It's going to be injured, and so it's going to be a little more uncomfortable. But it's not the end of the world. Most patients take after breast augmentation, take pain medicines for about 3 to 5 days. So I tell my patient, if you have surgery on Thursday, going back to work on Monday, it happens like 95% of the time. So I don't know. It's not that bad. Those of you who've had augmentation, chime in, let me know. So those are I would say, the cons to it. So we're going to talk about pros now. 1, going reverse the other way, is the aging breast and gravity. Big one. So unless you are a physique bodybuilder and you're actively competing, or a power lifter, I recommend that most patients have an augmentation with the dual plate technique or the implants under the muscle. That's my recommendation, and it's mostly associated to this is due to the aging gravity effect. So when you have the implant underneath the muscle, again, you form a scar bag, that capsule, and it's holding the implant up. Well, anatomically, your chest muscle will never really descend due to gravity. It's physically attached to bony structures, your frame, your bony structure. It will not move. It will not descend with gravity. Even as you get older, it stays exactly where you put it. So when you have that and it doesn't move, and you have the bag that has formed, the scar bag, the capsule, and the implant inside it, that means your breast implant will stay where you put it as you age. Even though your soft tissue around your breast tissue is getting thinner, you're losing collagen, you lose elasticity, gravity's pulling down other parts of your body, your implants will stay where we put them. That's just the way it is. But what will change is that the breast tissue around the implant is still under the effect of gravity. So when you have those women who have implants and they have very large breasts before they had augmentation, then that breast tissue is still susceptible to the gravity, and is still susceptible to the aging process. And so, as women who have, say 400 cc's, but they had like natural double D's before, 20, 30 years from now, what happens is that their breast tissue kind of descends over the implant. The implants are up here, but their breast tissue is descended. So you need to have with your surgeon. So 2, I would say it's more of a natural aesthetic of the breast shape. And so when you have an implant on the muscle, what's going to happen is you have much more of a smoother transition of the part of the chest, and because you have more soft tissue covering, which is the muscle. And so you don't get those 2 round ball effects with an implant on the muscle. It's much more fluid and more of a natural slope of the other part of the breast. Laterally along the lateral breast fold, you're still going to have just implant and skin basically, so especially the thin women. But that's going to be both cases for, with women on top of the muscle or under the muscle. You'll still have more of a natural, I guess, aesthetic of the lateral breast. But the upper part is very, very important. It's a natural. All right, so hope you learned something with this. I could talk about this literally for about 30 minutes, but this is a discussion you want to have with your surgeon. I think the recent trends is this subfascial, and so, if you have a surgeon who really is pushing that, just really understand, try to get them to fully explain why. I think, I just kind of told you why I think the submuscular plane, the dual plane specific technique, has a better, aging aspect to the breast for the women. For longer periods of time. And so I think women with a dual plane technique are going to have implants and breasts that really stay like that for decades. I just don't buy the subfascial technique personally. It's basically a subglandular technique, and I think the risk associated subglandular with capsular contracture in the aging breast and gravity, I think you just cannot deny that. And so that's pretty much a guaranteed revision surgery, like no question about it. You're looking at something's going to happen within 10 to 15 years. You have to kind of resupport the breast tissue somehow and put it back on the place or something, or have some kind of capsular contracture surgery, which that surgery just sucks, and you really want to avoid that one. That's the one that we really deal with the most, I would say, for breast augmentation, and you want to make that go down to almost 0. So anyway, hope you learned something today. Thank you for following me on the lecture series. Don't forget, like and subscribe. Drop me a comment in the comment section below, and stay tuned for more.